Get an adequate muscle repair, which you should have when you get a tummy tuck, period. I don't care what anybody says. A tummy tuck with no muscle repair is stupid. You need to be put to sleep completely because you need to be paralyzed. These surgeries that folks are getting not asleep is more dangerous than being put to sleep. Sedation, which is how Michael Jackson died, when somebody was sedating him without his airway being protected, is much more dangerous than general anesthesia. General anesthesia in a healthy person is actually very safe. Getting a tummy tuck and a BBL without being put to sleep is more dangerous, way more dangerous than getting one being put to sleep. I'm not sure what your fear is of anesthesia, but if you are afraid of anesthesia, that's fine. That's your right. Then don't get a tummy tuck and a BBL. People always do that. They'll be like, well, I want this, but I don't want that. It's not Burger King. And when you start making those types of demands, you keep shopping until you find somebody that's willing to meet them. Usually the person that's willing to meet them is the person who don't know enough to know that that's not safe. Because a real plastic surgeon is not going to be like, oh yeah, I'll do your tummy tuck with you awake. They'll be like, no, you have to go to sleep because it doesn't make sense. The people who are bending over backwards to ask for these ridiculous requests are the ones who probably shouldn't be doing it. I literally haven't seen a person get a tummy tuck. I don't know. None of my plastic surgery colleagues do tummy tucks awake. None of them. It's ridiculous. So that's a dangerous question that you're asking right there. If you don't want to get put to sleep, then just don't get cosmetic surgery. Don't get a tummy tuck if you don't want to be put to sleep. You don't have to be put to sleep. You don't have to have a tummy tuck. You just want one. Okay, let me go back. Nikki Burkneal, the BMI cutoff is different for different surgeons. So my cutoff is 33. My most beautiful results come from people with BMI of 30 or less. Like, the heavier you are going into the surgery, the harder it is to get to that perfect place in your mind as far as the goal. So the closer you are to your ideal weight, the better your outcome. So right now my BMI cutoff is 33. That might get lowered. See what other questions. Scars from lipo is with any other scars. There's lots of different things out there for scars. Lasers, needling, silicone sheeting, all kind of stuff. Okay. Okay, I'm going to go back down to the bottom because I think. You said, no, not yet. Please stay at 33. I lowered my BMI cutoff because I was having, people who were heavier, like it's harder to please them. The expectation, a lot of times people will have an image in their mind of where they want to be, and they're not really taking into account where they started. The image is of somebody else's body who's way smaller than them. And then I go and work my heart out, sweating up a storm, doing all this lipo, taking off, all of this fat. And then they're like, I still don't feel like I got to my result and I paid this money, And so I'm like, well, I did this work. It's not really my fault that you are heavier. We talked about this, but people forget like where they actually started. Bradley, my 3-year-old, my 3-year-old's coming busting up the video. B-Pops. Hey. Bradley Bennett. Didn't I tell you I was doing the video? Go ahead, Bradley Pops. Okay, go. Go ahead, Bradley. Say hi.
Hi.
You want to say hi, Bradley?
Hi.
Say hi, Facebook.
Hi, Fifi.
Yo.
All right. Yeah, so people will have... Okay, Bradley, go. People will have an image in their head of something that is... of somebody else's body. And then I can do all this work and then they're still not happy. And that's not fun for me or them. So I just lower my BMI cutoff so I could avoid those types of situations because it makes me feel bad and then they're mad and it's no good for anybody. Thank you, Amanda. Yes, it's safe to get repairs done. It's not, as long as you're in the hands of somebody who knows what they're doing. Smart lipo. Yes, I do micro needling. Smart lipo is a brand of laser liposuction. And I used to do laser liposuction a lot more than I do now. I don't really. I think it causes more scar, and then if somebody wants liposuction again, it just makes it harder because they have more scar left behind. And I don't really. The skin contracts without the laser. I feel like it adds more risk and more scar with very minimal reward. So I don't do laser lipo very often. I used to do it a lot. Drains. Oh, drains can stay in for a long time. But how long they stay in depends on what you have, how much they're draining. So that's different for different people. Yeah, Mika Letisa, you need to talk to your surgeon about your drains. All right, I guess that's all I had to say about that. You guys share this video. I know I'm going to make some people mad with this video, but whatever. I always make people mad. I'm just telling the truth. At the end of the day, just remember to be realistic. Remember where you are starting. Don't go looking for 9 and 10 liters of fat to be removed in one surgery. You need to plan for 2 surgeries, or you need to lose more weight to keep yourself safe. You need to make sure the person who's doing your surgery is really a surgeon, and a plastic surgeon specifically. Don't go to places that have a pattern of people with really bad complications or deaths. A death can happen from any operation, technically, but people who have a pattern of deaths in cosmetic surgery, that's not a place that you should go. Choose another place. And that's really it. That's all I got to say for tonight, y'all. So I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me via my website, which I'm about to put up right now, www.adarabella.com. And then let me pin it. Okay. I am having a Black Friday sale. I'm having a Black Friday sale, and that should be announced tomorrow. And then also, I'm going to have a bunch of really sweet specials for Black Friday. And it's only going to be for Black Friday. So I'm going to have it start probably at 8 p.m. on Thanksgiving night and end probably midnight on Black Friday. So I'll keep you guys posted on that. And then also I'm having a holiday party, a Preserve Your Pretty holiday party on December 9th at my office. And we're going to have lots of giveaways there, and more details will be forthcoming in the next week or so about that. You do have to RSVP for that event. I do plan to sell out on that one. It's going to be an awesome time. Live music, hors d'oeuvres, lots of giveaways, all kind of stuff. It's going to be a great time. So, I will be back on in the next day or two to talk about my normal stuff. But just everybody be safe. We shouldn't be dying from plastic surgery. We should not be dying from plastic surgery. Another beautiful lady has lost her life from plastic surgery, trying to get cheap liposuction. So that's not really the time to be looking for a bargain, is with your one and only body. All right, everybody. So stay safe. Bye.